the start of COVID in early March 2020, I was in Barcelona celebrating my 60th birthday with my family. We spoke very little about the coronavirus and I was totally unaware of any Spaniards being alarmed about it. My son lives in Barcelona, and many months later I asked him had he never read anything in the newspaper or heard in the radio, but according to him it had never been mentioned. There were no masks in the restaurants, no masks in the shops or the bars. Everybody was doing the usual hugging, kissing. Very normal. At the airport when we were returning home, there were quite a few people wearing masks, and that was the first I had seen this. To be honest, I just thought it was a total and complete utter overreaction. I believe myself I had COVID in mid-February, but when I went to the doctor I was told that I didn't have it. Obviously now in hindsight she was wrong. I do blame myself for infecting my husband and my brother and his wife as we were sharing an apartment. However, they were fine. It was like, our experience was like having a heavy cold with a cough. The only funny thing that was happening in the early time was my niece, who was with us, was constantly using sanitised hand gel. I'd never seen Emdy doing that before, and I never thought any much of it because she's a bit of a clean phobe. But other than that, holiday-wise, it was normal. The next thing, when I had arrived back from holiday, I had taken over the position as shop manager in a hospital shop, and I had been in a position 6 weeks, and my first main decision as manager was to close the shop to protect my volunteers. We went into lockdown the following week. All hospital shops were instructed to close, and it was all just a big rush to get shut. At the time, the weather was absolutely fabulous. I'm pretty sure that's what everybody will remember about the first lockdown. And it was great. It was new job, getting paid, furlough, fabulous, and sitting in the garden. It was lovely. However, the novelty wore off. When I realised we were going to be closed for months rather than weeks, I went into the shop with my husband, totally masked up, totally hand gelling as we went in. And we bagged up the stock, just bagged it up and distributed it to 12 wards in the hospital. This was a goodwill gesture. We did not charge them for it. It was put through the shop books as a donation. The hospital is a mental health unit, and patients were confined to wards for months. They had no visitors, no access to shops. It must have been absolutely awful for them because they couldn't even just take a wee walk round and get a coffee or a bag of crisps or an ice cream. It was awful. Everybody round about, I would say older people kind of panicked. I know I said I was celebrating my 60th birthday. I was working with volunteers in their 70s and late 70s into 80, and they were absolutely terrified. I wasn't worried about it because, as I say, I think I'd had the virus already, and if that was as bad as it was going to be, I wasn't worrying about it. I totally get why my volunteers were worried, especially as a lot of them had health issues too. But I don't think that was thought through properly, because quite a lot of people volunteer because they want company. I have a lot of widows who volunteer, And due to lockdown, they were now stuck in their house, scared to go out and not seeing anyone. And I can only think now that the mental health issues in this country must be through the roof. After 3 months closure, I asked if we could open the shop again for limited hours. I spoke to the manager of the hospital. I had a meeting with they had a COVID assessment team, and we did a risk assessment on the shop, and we came to a conclusion we could open for limited hours every day. I can't honestly explain what it was like to be back. It's quite difficult. First day we opened up, we were queued around the whole shop waiting to come in, and we were only 2 in, 2 out. It was amazing. The patients were overjoyed. This is a shop that sells cans of juice, crisps, chocolate, that kind of thing, cards, and also small gifts. The patients weren't particularly interested in gifts and things, but I think they enjoyed the fact that they could go to a freezer and pick an ice cream. It was just great. It was a great feeling to open up at that time. It took a while to get back. In fact, we're not back to normal because when I say we lost, I don't mean they died. I mean quite a lot of the volunteers have no confidence now in coming back. They don't want to be back in the hospital. They don't think they can work a till again. They just have now got issues, and they've decided volunteering's no longer for them. This is really, really sad. It's a problem throughout volunteering. Quite a lot of volunteers in all other sectors have decided that they don't want to do it because they got out of the way of into the routine, coming to the shop, doing a bit and leaving. And I think that's quite sad that these people are now sitting in the house. We're not back to normal yet either because we're now 3 years on and we still have to wear masks when we're working. It's a complete battlefield as the customers don't want to wear them. They don't understand why they have to wear them. They can walk about the wards without them. Visitors have to put them on when they arrive in the hospital, but they wear them under their chin, as is the norm. To be quite fair, the staff are also not wearing them correctly, and again, as I say, it's a daily battle asking people to wear a mask. I can't imagine how many millions have been spent on masks throughout this period, which, I'm not sure. I'm not sure it's a complete use of hospital money. I think that we should admit that isolating people didn't work. The virus was not curtailed. From where I could see in my house, the rules were getting broken constantly. There was people in and out each other's houses, meeting in garages, because they thought that wasn't a house, but I'm sorry, I can't see a difference between someone's garage and their living room. And an interesting thing I read last week is that the National Records of Scotland revealed statistics stating that between March 20 and December 22, 93% of people who died from COVID had at least one pre-existing condition. Now, I wasn't great at maths, but that means that 7% were fine. They were absolutely fine. And they were healthy people who were unfortunate, got the disease and died. Doesn't mean to say that they were totally healthy. There may have been something that wasn't undiagnosed. So for the sake of all these people who had other issues, everyone was penalised as far as I'm concerned. And I just think that was wrong. The thing I miss most was holidays. I had recently retired and I had planned to do a lot of holidays, and all that was stopped. Last year I had quite a few holidays, but I think I was owed them. I also really miss meeting up with my friends and going out socialising, going to the cinema, having a meal. And even now, some of my friends are quite, I think they've kind of got out of the way of going out. So when you phone to suggest going for a coffee or a meal, it's like, oh, right, oh yeah, we can do that now, can't we? Everything's really just a bit weird with some of them. But on the other hand, I developed friendships. I was on a course when the lockdown started, and I remembered that one of the people on the course lived on her own. She had no family, no children, and I texted her to see one day, did she want to do a Zoom just for a chat? And she was absolutely delighted, and that started out with a weekly thing. And I would say now she's one of my best friends, and we're going on holiday together. So although things were bad, there was something good came out of it.